Okay, welcome back. What's new? Doing good? Everybody have their coffee? Not a lot of coffee drinkers. You have your coffee? Homemade? Okay, so today we'll continue on talking about the prenatal stages of development. We'll try to remember as much as possible the main things that sort of stick out, the major takeaways. We'll do some sort of group sort of discussion about contextual factors that can impact positive outcomes for good prenatal development. We'll watch a short video that kind of covers a little bit more of the second and third stage. We said we're in 3 stages. Who remembers the 3 stages of prenatal development? Yes. Germinal, embryonic, fetal. Who remembers the different time frames for each?
2 weeks is germinal, 3 to 8 weeks is embryonic,
Yeah, exactly. Hey, the first 2 weeks is germinal, right? We're talking about just the replication of cells. Nothing more than a host and blob of multiple cells being protected. Beyond that, then we get to the embryonic, an embryo, right? We say, wow, a heartbeat develops. Major structures start to form, right? Major organs may start to form, right? The beginnings of those. And then we say, lastly, the fetal is quite a long time, right? Because we say 3 to 8 weeks for embryonic, we're talking about another 7 months of this final stage, right? All very critical, right? Because we say, hey, a lot of these zygotes don't make it. They don't make it to actually be a live pregnancy, a noticeable pregnancy, as you would call it. We say, hey, it needs to be implanted into the uterine wall in order for it to notify the body, hey, don't have a period. I'm actually pregnant, right? The hormones, chemical messengers sent out, take a pregnancy test. It identifies that there's a fertilized egg in the uterine wall. It's a pregnancy. Other times we say, hey, a woman may just have a period and all that gets flushed out because the zygote didn't get implanted into the wall, right? So it gets shed out through the period. So yeah, start from the beginning. 500 million cells, right? 500 million sperms, rather, from the man goes and get implant infused, right, with an ovum, a female egg. From there, we say, hey, it travels down the fallopian tubes, uterine wall, blastocyst, because it starts to replicate the cells. We say there's differentiation that occurs in this process. At first, it's all identical cells, then it differentiates for different purposes and features. Maybe some programming to make organs and all sorts of other things. And then we come to the embryonic stage. And so this is kind of where we'll talk about, and we may have touched on it, talk about teratogens, things that can majorly impact the development. Because we're like, hey, it is critical to have a few things going on. Proper brain structure, right? Proper nervous system, central nervous system, which is the spinal cord and the brain fused together. If you didn't know, they're almost kind of one thing. So the spinal cord and the brain are so tightly fused, you might be like a semi-truck to pull it apart. Right? That's how tightly fused it is. So it can be considered as almost like one central component, not 2, right? So we need that central nervous system in order to carry signals to the brain for functions, for movement, motor movement, for organ functions, hormones, all these different things, right? Critical. Right body temperature. So baby has to get to term to be able to sustain its own life, no longer needing the sustenance of mom, but that is a challenge, right? So we'll kind of look at all of these challenges along the way. All right, so we say we have amniotic fluid. Amniotic fluid, who remembers what that's for? Amniotic sac. Versus say the placenta. So we got placenta, we got an amniotic sac. Who remembers kind of the difference?
Is that maybe to like protect?
Yeah, we say, hey, embryo's gonna be in the amniotic sac to protect itself from the outer environment of that area. Whereas the placenta is almost really a separate organ. It's like a separately created organ to function between mom's body and baby's body for nutrients, dispelling waste, right? Getting all type of proper things needed for growth. Beyond that, we have what's called the neural tube. So this occurs in the embryonic stage. The neural tube is essentially what's going to form the central nervous system, spine and the brain together. We'll see in one of the videos that begins to overlap. All right, so in this fetal period, right, baby grows 9 weeks to birth. We say due dates kind of a little bit different. We say gestation is about 38 weeks. On average, due date could be anywhere between 37 weeks and 42 weeks. Right, so we say there's a lot of rapid growth at this stage. Later in the pregnancy, we'll see that if baby doesn't develop by gaining proper weight, we can have what's called a low birth rate, right? And that would make it susceptible to not being able to survive on its own, right? Why do you think something like low birth weight would impact survival? Like what could be related to low birth weight and other surviving functions? What can low birth weight you think indicate? Yes?
Was it like developed or something?
Yeah, you say, hey, you know what, we should have an average size of human. Here we're talking about at least 5.5 pounds in order for us to truly know that organs are fully developed. Meaning if the lungs are not fully developed, they're not going to get proper oxygen. No proper oxygen impact the circulatory system, which means that baby could possibly have a stroke, right? Not being able to properly breathe, major asphyxiate, all sorts of things, right? Heart not functioning properly, liver, pancreas, all of that. And we say the age of viability. That's sort of a phrase used to indicate that baby's actually able to come out of the womb by any measure, cesarean or otherwise, and be able to survive using sort of advanced medical procedures, right? Breathing machine, may be fed an IV, nutrients, but it's to the point that it probably will survive. If not, usually there's low chance of survival. All right, and we talked about teratology, right? Teratogens. And we say, what are some teratogens that can impact the development of an embryo or even the fetus? Yes?
Drugs and alcohol?
Hey, we say drugs and alcohol. Over-the-counter drugs, prescription drugs, drinking, right? Maybe excessively, or drinking at all may impact. Smoking, cocaine, opioids, right? All of these things can impact development of the brain, or impact even like socio-emotional sort of issues later on in life. Right? We would say we're causing an influx of toxins or irregularity of hormones. All right, so some contextual factors, right, and teratogens. So we're saying contextual, hey, intersectionality matters. Like, well, what does intersectionality consideration of all perspectives in terms of good development. One, we're just here, we're kind of focusing on the biological aspect, right? From our hormones, development, features of organs and structures. We're like, hey, what else can impact, even besides, say, drugs, alcohol? So my first question that in your groups we could discuss is, in a contextual standpoint, let's say situational, right? We'll say contextual, rather always say situational. What can impact the healthy development during these three stages in terms of some factors like home, family, relationships, community, and other, right? Whatever else you could consider. Right, so think in context like what other things outside of just pure biology can affect the prenatal development? What can affect the biology? Right? What can make someone sort of engage in intaking teratogens? Right? What can make a child not succeed by getting proper care that it needs medically? What stops a mom from receiving that proper care? What sort of factors in the home dealing with dad being present or not present, right? Socioeconomic factors, family factors, support, social systems, and all sorts of support. All right, so let's see what we come up with within our groups, talking about what sort of other issues can affect the development. I give you about 5 minutes to discuss. See what you come up with. Yeah, think of social issues that a mother can face, or the household can face altogether. Barriers and restrictions to getting certain things accomplished during this development. Things that create stress and anxiety. All right, I give you 2 more minutes. All right, let's see what we got. We'll start over
You know
here.
what I mean?
What did your group come up with?
Like your financial situation or like your support system, or maybe if you have an abusive relationship.
So back with finance, like in what way is that going to impact the program?
Like if you can't afford healthcare and like checkups and stuff like that, to make sure that everything's done.
Yeah, think about it. You're like, hey, you're pregnant, right? I mean, there's only maybe so much you can do. Maybe you could work and get leave of absence or something, but that might even be an issue too. Maybe you don't have a support system, a counterpart in the house that can provide income, and you don't have insurance. You don't have insurance, you're racking up how much costs to bring a baby to term, I don't know, maybe $200,000 or something, medical, excuse me, right? So your insurance, lack of insurance, lack of access to medical care, so money is important, right? During this book. You said something else.
Um, yeah, abusive relationship.
What about relationships?
Like, let's say the father of the baby and between the mother, like, you don't, it's like an abusive relationship and that could like harm the baby in some
You
way.
say toxic or abusive relationship. One of it's abusive, you may kill the child if it's like physically abusive, right? Two, if it's toxic, it's stressful, filled with anxiety, that's a raging influx of hormones, right? All sorts of things, right? And those hormones going up and down are not very good for any development. There's even research to support that sort of an inconsistent raise of testosterone levels in women during this development creates all sorts of sexual problems later on in life for the child, right? Stuff you could look more into. Okay, so we say, hey, you know what, that stress can lead to all sorts of things. Right? It can lead to eating poorly, maybe not really taking care of yourself, diet-wise, right? You're eating just bad food all the time because you're stressed out, and other things. Okay, good. Next. Right there.
Basically said the same thing, but I also wanted to add, like, if the mother is a single mother, that can like cause fear or stress, like how am I gonna raise this child?
All right, so once again, just worry and stress, right, about like the future. Okay, next group.
He kind of says the same thing about relationships, like if his significant other is not there to support you, that's gonna cause you stress at the time of baby.
Is it just about having like a partner, or is it just about having some other support system?
I would say support mostly.
Okay, like family, maybe?
Well, I mean, depending on the pregnancy, depending on the person's family, might be opposed to it.
Okay. So family can also be a factor too. You think, all right, well, you don't have dad walked away or something, right? Issues there, but maybe you still got mom, you have grandma, you have aunts, uncles, sisters, brothers, you still have support. Right? And they're gonna supplement and help you out in any way, shape, or form. That's usually how it goes, right? Okay, so family.
One of ours was like peer pressure from friends or like older family members with like outdated pregnancy information, or like they'll be like, can you could just take a sip of this circle with the baby before that?
All right, we say peer pressure,
And outdated like information.
outdated information, right? Would you describe any of that as like, is that purely social, or is that like a cultural sort of phenomenon?
A generational thing.
All right, it's like a generational thing, like, hey, we used to do it this way.
Yeah, I mean, I guess it would be cultural too, because like some cultures believe certain things about like pregnancy that you can and can't do.
Yeah,
But
you say,
what they
hey,
think is okay.
this is the way we do, but maybe that kind of conflicts with medical knowledge,
Right.
right? Scientific knowledge. Right, that's, like, hey, look at our other cousins, they got issues, why are we still using the same practice, right? Alright, so they say, peer pressure from family, outdated information and cultural practices that may influence that. Next group.
We mostly discussed the same thing, but another thing for community we said was if the environment, like the neighborhood is like in a like more bad state of affairs, that can put more stress and anxiety in the mother.
Yeah, you say community, hey, community is your actual like day-to-day environment. And you're like, well, alright, tell me about your day-to-day. Hey, it sucks here. There's a ton of violence. Everybody's poor, right? So your mind frame, your mindset is totally screwed. Maybe it's the environment that leads one to participate in the drugs, right? Like, hey, there's really quick, cheap access to weed, really convenient, cheap access to alcohol. There's all this around. Maybe your environment is discriminatory. You're like, hey, I'm the minority over here, right? And there's some other dominant groups who have power and access and privilege, and I feel oppressed. Right? I don't feel like I can get ahead. You're like, well, that's pretty stressful. That's an actual everyday experience of worry, stress, and anxiety. Right? So community is extremely important, maybe one of the most important, because it's like, it's your total environment, right? And you have to live in that environment there day to day. We say we could just simply drive around the city of Chicago, we come in beautiful river forest and walk down the street, see multi-million-dollar homes, how quiet it is, beautiful, right? The mindset, the mind frame of individuals based on this nice, cozy environment. And then we could go to other parts of the city. And the immediate question is like, man, why? I wonder why it's like this over here. It shouldn't be a why. I mean, it should be pretty simple. Like any organism usually adapts, assimilates, acculturates to this environment. You put any one of us in those environments, give it enough time, we will assimilate with that environment. You put us in prison, I guarantee you, first thing we're thinking of is survival. We may have a prison mindset after 3, 4, 5 months. We may do things we wouldn't thought we would ever do before, because we were so nice and things were so cozy in the outside world. Well, then you change with your environment. Put us in World War II, maybe 98 or 99% of us would be Nazis, executing women and children. Why? Based on our own survival, based on that environment. And that environment is extremely powerful. It's about life or death, right? So community and environment is extremely important in the context of situational sort of decree. Next group.
We said, home, maybe like life support, if you're like a single mom. Maybe like trying to take care of like your other kids while like you're working on yourself, which can cause like my mom said, when she had me, she said like, my dad wasn't around, so it was just like her making me and then my two other siblings. They said that it caused her like more and more sickness, tiredness, like trying to cook and clean, and it caused her like to have more like sickness when she had me, because she was just trying to do it all alone, doing everything by herself.
Yeah, absolutely. That stress lowers immune system response, right? It lowers the response to white blood cells attacking viruses and other pathogens in the body. So it's like, hey, mom's always sick. Mom's always got viruses, colds, germs. It's going to impact me as a baby. What are those viruses going to do to me later on in life? Right? Things like the measles. Mom having measles can kill a baby in this sort of prenatal period, right? Having multiple coats can impact the development. So you kind of like, hey, mom is so busy focused on other stuff inside the home, she's kind of abandoning her duty to really just focus on bringing me to term in a healthy way, right? So the home environment, very, very important. And then one last group back there.
We have something that can follow their family, community, and other. So other than
Yeah. All right, we say, hey, maybe there's addiction. You're like, well, we just heard how it can impact. One other way it can impact, like, yeah, mom. Anything happens to this baby because of your addiction, because of the environment, you're going to jail, right? You're going to jail because literally the law would consider that you caused the fetus to die based on your behavior, right? Go to the hospital, social workers show up, writing all type of documentation about your progress, and they see that your behavior has caused this fetus to be born and not survive, not thrive. They'll see the condition of it. Yeah, you might be criminalized. So that even in itself may cause fear to stop going to the hospital. You're like, oh, I smoke weed all the time. You know, I'm gonna just try to show up the last time for when it's labor time to have this baby. Maybe I'll sneak try to have it at home. Maybe I know someone, a midwife or something that can help. I know once they find out I got all these things ingested inside my system, they're gonna notify social services, Department of Health, the authorities, and possibly be criminalized to a degree. All right, so lots of factors. So we say, hey, it's a bigger picture. Okay, we got the biology of it. Great. Baby is very sensitive at different stages, critical periods, but there's also like a lot of things outside that can affect our psyche, which in turn affect our behavior that can harm the child. One of the things is fetal alcohol syndrome. Right? I think we touched on that. This one's very common, right? A lot of moms do like to drink. And I'm not saying excessively, but sometimes even drinking anything can be kind of not recommended by your physician, right? Maybe based on family history or some other genetic factors. So we say with fetal alcohol syndrome, there's some phenotypical sort of markers. Low nasal bridge, short nose and a flat midface, a smooth philtrum. That philtrum is a little indentation between the nose and mouth. Thin upper lip, small jaw, right? Microcephaly, small forehead. Epincanto folds, the extra folds in the eyelid, and minor ear abnormalities and palpable fissures. Right? So we say there's a lot of things that can show up physically, and these are just physically, but what's going on beyond, obviously we say, well, maybe the brain tends to be a little bit smaller than the average person, right? That might have cognitive abilities. Short nose, flat midface, I don't know, breathing issues, right? Thin upper lip, speaking issues, minor ear abnormalities, hearing issues, short palpable fissures, vision issues, right? Small forehead, once again, something that indicates there may be different structures behind there in the brain. Okay, moving on to some cultural differences, right? In home birth, natural childbirth, all these sorts of things. Once we get to like labor. Well, first let's talk about prenatal care and going on with our context. 25% of women do not receive prenatal care until after the first trimester. Usually that's because of income issues, not having insurance, of lack of medical assistance. Race, ethnicity, and prenatal care. Prenatal care is closely linked to education, which means the lower the education level is a predictive factor of one not doing the proper treatment to have good healthy habits during prenatal development. Strong connection between low socioeconomic status and poor birth outcomes. So poverty and poor birth outcomes are highly related. Some protective cultural features. So some cultures actually have a heavy emphasis on supporting during these stages. Latin communities really do have a really heavy support system, right? Latino women also often contribute to positive birth outcomes. These ideals These sort of practices and ideas, they lessen once Latino women become westernized or Americanized, as we may call it. But traditionally speaking, there's a lot of heavy emphasis on making sure that the baby comes out healthy and have good results. The first stage, so moving on to childbirth. The first stage of labor is the longest and is known as dilation. Who knows what dilation is? Yes. Yes.
Oh, yeah, it's when the woman dilates enough, or the baby will come out. Typically comes in the right?
Yeah, right. We just say full dilation is 10 centimeters, right? So from 0 to 10. We say, hey, the cervix begins to open. The birth canal starts to create enough area for a child to be able to pass through in a healthy manner, right? Being able to pass through, and it's really restrictive. You know, baby might get stuck in there, strangled or something by an umbilical cord. Anything happen if it's not dilated fully. Medication during delivery. What kind of medication do women take during the labor? Yeah. What is epidural?
What's this pain, no? Labor?
Yeah, where's it given?
And numbs your legs.
Yeah. So we say, hey, we give some sort of anesthesia to numb the pain, but for you to still feel that you are contracting and pushing, but it's very painful to have a child, right? Some mothers prefer to have a natural childbirth. They don't want the anesthesia because they may claim that there's research to suggest issues later getting epidurals, right, or all kind of anesthesia during this process. But an epidural is inserted into the back, administer some anesthesia. Really you're not able to feel pain from, say, belly button to the top of your leg, right? So that helps. There's some other techniques, natural techniques, such as what's known as Lamaze. Anyone familiar with Lamaze? Right, and basically Lamaze is just a process of breathing and focusing, right? It's breathing techniques in order to control the pain in a natural way without needing anesthesia. C-section, cesarean delivery. What does that encompass? Yes.
They would cut the women under from the belly button down and then take out the baby.
Okay. And what would be some of the reasoning behind that? Yes. Gee, both of you hit that.
Due to emergency or like the umbilical cord is wrapped around the baby's head,
Yeah.
which we call like to go with the surgery.
All right, you're like, hey, what's going on with the baby? You're like, I didn't dilate enough. It's in a breached position, baby. Like, what is a breached position? We're thinking like, well, usually we want the baby to come out head first. That makes survival a little bit easier, right? Comes out, is able to breathe, we can worry about the rest of the body later. But breach means it's coming out feet first. Like, wow, that's kind of scary, right? In this whole process, because, yes.
And the hips would just be too small also.
Yeah, there could be sort of even traits that you have where you have small hip, right? They're not able to expand enough for you to pass a baby through. So you get a C-section. 1/3 of all births are C-sections. So 1/3 of all births in the U.S. are C-sections. Baby can not only be feet first, sometimes it could be horizontal. It could be kind of laid to its side, right? Sometimes caregivers sometimes women have a caregiver called a doula, right, which kind of helps through the process of prenatal. Sometimes there's a midwife. A midwife is a person that can help you through labor, right, and kind of coach you through. Almost 2% of births in the U.S. are at home, not in hospital facilities. Cultural differences in childbirth, right? Birth birth is a private event in the United States with families visiting after the birth. Different in other parts of the world. In Italy, it's a sort of community event, like everybody in parts of Italy, I would say. I know like in Sicily, they have it where a whole neighborhood comes when the baby's being born and everybody celebrates, prays, and cheers you on, and things like that. All right, in South America, right, the Jahara people of South America gives birth in front of their entire communities, right? So this group actually, everybody watches the birth, right? Phenomenal experience. It could be life-changing. I have two kids, two small kids. So my son Christian, he'll be 5 next month, and then Chloe, she's 3. She'll be 4 next year. And it changes you. I wanted to watch every single thing. Like, I did not leave. I was looking at everything as it happened and occurred, because to me it changes you. It gives you a different perspective on like the miracle of life, right? Some people don't want to see it, right? I know a lot of men that particularly don't want to get that involved. In Ghana, birth is tied to social status. In Mexico, the Maya conduct rites to protect newborns from evil spirits. Right, so they kind of get in a circle, do chants, praises, prayers to protect babies from spirits, evil spirits. The Zenaquinteco, also in Mexico, place their newborns before a fire and pray to the gods for protection. So it just goes to show you different parts of the world bringing into a child is really a big deal, right? And you want to either protect them or do something to give them the best chances of survival. Okay. We'll save the rest for Friday. We're going to watch just a quick video to kind of reiterate the process of prenatal development. And then we will call it a day. All right, think of, hey, we don't really have, there's no universal definition of what a baby is. Is a baby after birth? Is it neonatal? Is a baby a zygote? Is it the zygote, right? Where a fertilized egg and sperm fused together? Is it an embryo when it has a heartbeat? Is it non-embryo? Is it a fetus? Right? All the arguments we can make, you're like, well, it doesn't count yet because all the organs haven't been developed, you know, so maybe an embryo is not a baby. Others be like, well, you know what the zygote is, because really that's when conception happens. Conception is when you begin to multiply cells, right, to form a human being. Or one may argue like, hey, you need everything in place, all the organs, all the limbs, eyes, skin, all these sorts of things, right? So we don't have a set sort of universal definition. Is still sort of very fluid depending on one's position. But let's watch a month-by-month guide on pregnancy.
From conception to labor, your baby is constantly growing and developing. Around the 5-week mark, your baby's heart will begin to beat. At 27 weeks, they'll have regular sleep and wake cycles. And at 39 weeks, your baby will be physically developed. Use this timeline to learn how your baby is developing throughout the pregnancy. For the first few weeks of what is counted as your pregnancy, you're not pregnant yet. This is the time between the first day of your last period and when you ovulate and conceive. Over the next several days, the fertilized egg will start dividing into multiple cells as it travels down the fallopian tube, enters your uterus, and burrows into the uterine lining. You're now about 4 weeks from the beginning of your last period. This ball of cells, called a blastocyst, has begun to produce the pregnancy hormone, HCG. This hormone tells your ovaries to stop releasing eggs and can be detected by a pregnancy test. A mere 16 days after conception, your fetus's neural plate forms. Think of it as the foundation of your baby's brain and spinal cord. The neural plate folds onto itself to form the neural tube, which closes by about week 6 of pregnancy, to eventually become the brain and spinal cord. Folic acid is one of the B vitamins that help form this neural tube. Because your baby's nervous system starts developing right out of the gate, it's important to consume 400 micrograms of folic acid daily before getting pregnant, and up that amount to 600 micrograms once you do. This can reduce certain defects of the brain and spinal cord by more than 70%. At 2 months pregnant, the cluster of cells that will become your baby's heart has begun to develop and pulse. Your baby's face and buds, which will eventually be limbs, begin to develop. Organs such as the brain, sensory organs, and the digestive tract begin to take shape. Your baby has what looks like a little tail. It will recede after a few weeks and form the tailbone. At 3 months pregnant, the embryo already has a human appearance. The limbs, hands, feet, fingers, and toes are recognizable. Their skin is so thin that you can see the blood vessels beneath it. Though reproductive organs have begun to form, they can't yet be determined on an ultrasound or sonogram. By the end of the 3rd month, your baby is fully formed. They weigh about an ounce and are 4 inches long. Since your baby's most critical development has occurred, your chance of miscarriage drops considerably after 3 months into the pregnancy. During the 2nd trimester, very fine wisps of hair appear on your baby's body. This is called lanugo and plays a critical role in protecting the fetus from damaging substances found in amniotic fluid. Your baby's senses, smell, vision, touch, taste, and hearing are developing, and they may be able to hear your voice. Your baby's eyelids are still fused shut, but they can sense light. If you shine a flashlight on your tummy, they'll move away from the beam. Their movements have gone from flutters to full-on kicks and jabs against the walls of your womb. Ultrasounds done at 4 months pregnant may reveal your baby's sex. Here you are in your 7th month of pregnancy. You've come a long way. During the 3rd trimester, your fetus continues to grow in size and weight. Your baby's lungs are beginning to reach maturity, meaning your baby would have a good chance of surviving if born now. Starting in week 36, your baby gains about half a pound and grows half an inch a week. Many babies turn head down and stay in that position until birth. Thank you for watching this video. Please watch my other videos if you would like to know
Alright, and
what
then
to
one
expect
thing
during
last to
vaginal
note is
delivery or
during
C-section.
the neural tube, if that's not formed properly, you can have what's known as spina bifida, which is at the end of the tailbone doesn't fuse properly and the nervous system begins to kind of grow outside of the body, causing paralysis, or anencephaly, which is the top of that kind of system where the brain doesn't, it leaves like an opening in the brain, in which case the baby will die. Okay, everyone, have a good rest of the day, and I will see you on Friday.